Hello, everyone. My name is Tiffanie, and I'm the Chief Operating Officer here at Naluri. And today, I'm joined by an amazing group of panelists to talk about a very important topic, coping with diabetes. And some of the few things that I want to get covered today is, for starters, what is diabetes? What are the different types of diabetes? And how can we prepare ourselves in the event that we are diagnosed with diabetes? How do we best manage this chronic condition? What are some of the potential complications that may arise? And finally, the importance of social support. And for today's session, I am joined by Dr. Shah, who is a family medicine specialist with training in genetic profiling, healthy aging, as well as chronic disease prevention, treatment, and management. Also with us here today is Jennifer, our pharmacist with more than 18 years of experience in hospital pharmacy, community pharmacy, and also management. Her areas of interest includes non-communicable diseases and also smoking cessation, just to list a few of many. And last but not least, we have with us as well Michele, who is our resident rockstar dietitian, who has over 7 years of dietetics experience in both community and also clinical settings. Michele's passion lies in providing individualized nutrition care and empowering her patients and clients to achieve whatever their nutritional goals may be. So thank you very much to all three of you here for joining us today. And I hope you guys are just as excited as I am for today's session. So I'm just gonna jump straight into it. And the first question goes to Dr. Shah. And I have, done a little bit of Googling. I must say that I'm definitely not an expert in this topic, but based on our latest National Health and Mobility Survey in 2019 by the Ministry of Health, up to 8.1% of our adult population is at risk of diabetes, high cholesterol, and hypertension. So that's close to 1.7 million adults. So would you mind sharing, Dr. Shah, what exactly is diabetes and are there different types of diabetes?
Yep, sure, Tiffany. Thank you, everyone. Nice to see you all again. Okay, when we talk about diabetes, it basically is about sugar. Yeah, or in this way we term it as glucose. We cannot run away from talking about diabetes without talking about glucose and insulin. So basically, it's the problem of these two things, right? So whatever we eat, whatever food we eat will be broken down and become glucose. Okay, and this glucose will travel in your blood, and they should go into the cell where they are converted into energy. So diabetes happens when these glucose are not brought into the cell. Okay, so they stay in the bloodstream. They can't get into the cell, and because of this, you have high blood sugars. Okay, and this I'm sure you'll go into later will cause further complications. Basically, there are two types of diabetes. We used to call them type 1 and type 2, but now it's more, the first one is insulin dependent, okay? And the other one is non-insulin dependent. Most of the time, what we are talking about will be the type 2 diabetes, the non-insulin dependent diabetes, okay? The insulin dependent ones are usually in children, more so genetical, as opposed to the type 2. So basically what we are talking about is a type 2 diabetes, which happens in the later stages, more chronic, and also there are more things you can do to prevent it, really. I think that's in a nutshell what diabetes is, yeah.
Thanks so much for sharing that, Dr. Shah. So just going into a little bit on this type 2 diabetes or the non-insulin dependent, are there different stages at which an individual can be diagnosed?
Yes, unfortunately, that's the problem. Yeah, in Malaysia, as in most chronic diseases, a lot of these diseases are diagnosed quite late. So the patient might have had diabetes for a long time. They don't do medical checkups. So you have this problem of the blood glucose is high in your body for a very long time, and this high blood glucose will cause complications. So yes, there are different stages. Yeah, and most Malaysians tend to present at quite a later stage when they already have complications. So this is not a bit more difficult to treat in a way, yes, but we want to prevent the complications. That's probably the most important thing. So again, early detection is always our primary in diabetes management, really.
Yeah, no, thanks so much for that, Dr. Shah. And you're absolutely spot on because in the same survey that I read, it was also found that up to 49% of people with diabetes either have never been examined or diagnosed with this chronic condition. So that's
Yeah,
quite terrible because, as you said, the later that you diagnose it, the more complications that a patient would have to suffer from. So I
yeah.
want to get a little bit more into the importance of early diagnosis, maybe a little bit later when we get into complications. But first, I would actually like to hear from all of you. Based on your respective experience working with patients, what do you think are some of the barriers in people who are at risk of diabetes getting examined or diagnosed? And maybe for this, let's start with Jennifer.
Hi, thank you, Tiffanie. I think that Malaysian or generally Asian, they have the mindset ignorance is a bliss. So I don't know, I don't have issues. So once I check I have issues, then how am I going to cope with that? So that is a biggest barrier, which is a psychological barrier that they have, because that they are not sure what will happen if they are diagnosed with that. Very rare that people will think of that. If I know early, I can treat early. To them, having a diabetic is more or less equal to like a death sentence, or it will be a very bad situation for that. So I guess that there is a lot of things that we can do to actually to promote the awareness of early diagnosis, or even just a simple screening test.
Mm-hmm. Thanks a lot for that, Jennifer. What about in your experience, Michele? What do you think are some of the barriers that people who are at risk, especially when you have a family history of it, like what stops them from just getting this simple test to find out more?
I think Jennifer put it really perfectly. It's always the lack of awareness. People don't see it as something very important. Usually, being from a clinical background, I see a lot of patients with diabetes coming in the hospital with some kind of acute condition. So they come in the hospital, their objective of coming in the hospital is solving whatever acute condition they came in with, ignoring the fact they do have diabetes on top of that can actually affect the recovery of the acute condition. So they do put that at the back of their head. And I think it really comes down to the lack of awareness, and as well as if I don't physically think about it and it's something that doesn't exist, but not knowing that these are the conditions that can affect your recovery as well.
Yep, got it. Thanks a lot for that, Michele. So Dr. Shah, what were, maybe if you could share, what are some of the symptoms or maybe risk factors or medical history that would put someone in a position where we should highly encourage them to get tested regularly?
Okay, I think just adding on to the last question, I think the other most important thing is why people don't get screened is that most of them are asymptomatic or they don't have any symptoms. So you don't, there's no pain. So people don't go searching for it. I think most people who are diabetic, diagnosis of diabetes are incidental. Yeah, so they have no symptoms. So that's probably one of the things that is a bit difficult for them, makes them a bit difficult for them to come out and do the test. But you are right. If we made known the risk factors for diabetes, then probably this group of people would be able to come out to have it tested. Yeah. So when you're asking about risk factors, there are quite a few. Yeah. There are modifiable and non-modifiable risk factors. Non-modifiable risk factors include if you have a strong family history. Yeah, that is very, very important. If you have a strong family history, your chances of having diabetes are that much higher. Yeah, if you are overweight, okay, that again is another big risk factor for diabetes. If you have high blood pressure, if you have high cholesterol, those again increases your risk of having diabetes. If you're inactive, you don't exercise a lot, again, there is another risk factor. Mm-hmm. Ladies, if you have diabetes during pregnancy, yeah, then you are at a higher risk of developing type 2 diabetes sometime in the future. So these are some of the risk factors that should bring you alarm bells. But I think as you grow older, if you are 40 years old, then 20% of diabetics in Malaysia are between 40 to 50 years old. Right? And when you get into 50 years old, that goes up to 30%. So actually, those above 60, if you are above 60, you have a 40% chance of having diabetes. So that's quite high.
That's almost half.
Yeah, so 40% of diabetics are actually above 60 years of age. So age itself is already a big risk factor. So, I mean, it's not a difficult thing to do, as you know, to screen for diabetes. So those are the risk factors. If you have them, I think you should have it checked. Again, Malaysians have very, very poor diet. Yeah, I'm sure Michele would agree with that. And I think everybody should have it done. You don't have to wait. It's just a simple test anyway. Yeah.
And then in terms of how frequently should a person get tested, and I imagine it to be different for someone who is 40 versus someone who is 60, but what is the typical time duration that you think someone should get tested?
In my opinion, I get my patients to do it annually.
Okay.
Because you're not exposing, it's not a test where you expose the patients to radiation like a scan or anything like that. It's a simple procedure. It's quite cheap. It's not doing the patient any harm. So I would do it annually to all my patients. Yeah.
Okay. Thanks a lot for that, Dr. Shah. I always love your explanation. You always go like 2 steps beyond and then break it down to like part 1, part 2. So thank you very much for that. I am learning so much, and I hope everyone else who is listening to this is also learning just as much as me. So maybe getting into a little bit more around once a person does get diagnosed with either being pre-diabetic, so they're at risk, or they find out that they are diabetic. Jennifer, from your experience, what are some of the most immediate complications that arise for someone who has just been diagnosed?
Just to go back one step backward on the questions just now, as Dr. Shah said that a lot of people do not know that they are diabetic because they are asymptomatic. But on the other hand, actually a lot of them, they do not know that symptom is actually related to diabetic. For example, that they have like frequent urination, that they feel thirsty, and then maybe that they have wound that is very slow healing. So these are some of the clinical symptoms that the diabetic may have. So initially when they come with diabetic, the initial things can be the complication or can be the symptoms of it. Because when you have diabetic, you do not have your source of energy. You have a lot of sugar, but it's not turn into energy for you to use. So a person usually will feel very tired. And then at the same time, since that you have a lot of sugar in the blood, so a lot of time they may have like skin issues, or the blood circulation is not good. They have dry skin, they have itchy skin, and then they have wound. They actually takes very long time to heal, because that not only we human like sweet things, actually bacteria, all the germs also like sweet things, because that is a source of food for them. So the complication may be related to the slow healing of wounds. So especially if it's an elderly, when the skin texture is actually not that well, it will even take longer time. So on top of that, the usual one that we can say that complication for diabetic is actually from top to bottom. So the most common one, what we will see is actually the eye problem. Then everyone will know will be the kidney problem in long term. But a lot of them also may have issues like the numbness of the hand or the extremities or the legs, because that the nerve endings is actually not so well for diabetics. So this is one of the quite common complications that we see in a diabetic patient.
I see. Now I know bacteria also likes sugary stuff. So I actually have something in common with bacteria, as I've learned today. Thank you for that, Jennifer. And Michele, I guess in your experience as a dietitian, if you don't mind sharing, what are some of the kind of immediate challenges or pushback that you have heard from your patients when it comes down to making the very necessary dietary changes?
Barriers and changes would usually be the same. It will always be like, but this is Malaysia, food unhealthy food, unfortunately, is so accessible in Malaysia. So it's one of the biggest challenges trying to even come to the stage of trying to motivate them to make a change. I think it comes back to the whole ignorance is bliss condition. So if I don't think about it, I don't have to make any changes. But in terms of a lot of patients do feel that if they do take medications, they don't really need to look at their diet, which is like a huge myth when it comes to diabetes because they work hand in hand together. So yeah, one of the challenges I would say is actually just motivating them to take control of this disease. And I constantly like to tell my patient that diabetes alone, the disease by itself, it's not that scary if you manage it well. It's the complication that is a problem to all of us. Yeah, it's the things, it's the condition that leads to mortality. It's the complication. It's not diabetes itself. So as long as you manage it well, that it's not such a, because people hear diabetes, they get really scared. They think leg amputation. It's always the first thing that people think about when it comes to diabetes. But it comes back, I guess it comes to Jennifer's point where these are all just complications like the numbness leading to amputation and things like that. They're all complications. So as long as you manage it, there's no need to have to go through all that things.
Yeah, thanks so much for that, Michele. And that actually leads me very nicely to the next question that I had for Dr. Shah. So does the diagnosis of diabetes put people at risk of other chronic conditions or other severe symptoms that may affect their day-to-day lives?
Definitely, as Michele has said, you don't die from diabetes, right? Diabetes does not kill you. It's the complications of diabetes is actually the ones that cause you the biggest problems. Yeah. So from head to toe, like Jennifer said, you can have, if you leave it, you can have complications from every organ from head to toe. Where do I start? I don't even know. Okay. From your eyes, you can get diabetic retinopathy. You can get taste disturbances. Heart problems is really, really huge. Yeah. So if you have diabetes, your risk of having a heart attack is the same as somebody who already has a heart attack. So your risk is automatically increased, right? Your chances of getting the lottery has gone up tenfold, right?
The lottery I want.
Yeah, not. It's not the lottery that we want. Kidney problems, yeah, amputations, nerve problems. Where do I stop? Yeah. So I think, as Michele has rightly said, unfortunately, in Malaysia, the way I see it, the only way you can go is scare tactics. That's it, right? If you're not scared of that, then I don't know what will. Okay.
I think that would be the first stage to kind of bring them towards that change.
Yes, exactly. And then I think the other thing is you must tell the patients that, look, you have diabetes. We are here to help you. We are not responsible for you are responsible for your disease. We are here to help you. Most patients will, I have diabetes or I have high blood pressure. There you go, doctor. This is your responsibility. Please control it for me. It doesn't work that way. Okay. I think the first thing is you need to give the responsibility of controlling it and care to the patient. We here as a team are supposed to guide you, but you are right. Yeah, there are many complications, and that diabetes itself won't kill you. And I think this is the first thing that you need to put through to the patients so that they actually know what is the importance of controlling their diabetes, because there are so many patients. My patients say, "Oh, when you ask them, did you take your medication today?" No, I didn't take, doctor. Why? Because my blood sugar is normal. Right? And you ask, did you check it today? No, doctor, I didn't check, but I can feel it. Right? Malaysians are they're very, yes, yeah, they have this extra sensory perception that they can sense their blood sugar is normal, their blood pressure is normal without even checking them, right? So we have to change that mentality. We have to tell them, no, you have to be a bit more responsible with your medication and everything else. That is extremely important, I think.
So thanks so much, Dr. Shah, for bringing up medication. And I guess I've heard firsthand and also read around a little bit, one of the reasons for poor medication adherence is that people fear side effects. So maybe if you don't mind sharing, Dr. Shah, number one, I think, what are some of the common medications that are typically prescribed to a diabetic patients? And number two, what are some of the known side effects that typically comes alongside with it?
There are many sorts of medication currently, from the old sort of sulfonylureas, metformin and stuff like that. So now we have glitazones and all kinds of wonderful stuff. Most of them are quite safe. Yeah, most of them don't cause hypoglycemia where the blood sugar is too low, but some do experience nausea, vomiting. Two of the more common ones. Yeah, but interestingly enough, Tiffanie, as you said, a lot of patients are scared of side effects. Yeah, so I always tell them, there's no medication in the world that there's no side effects. Okay, when you're crossing the road, you can get a risk of being run down by a car, right? So I always say, look, if you don't take your medication, it's like me putting you in a cage with a lion, right? And if I
like
give you
scare tactic. I do actually feel scared.
Exactly, right? But if I give you the medication, yes, there's side effects, but I'd probably be putting you in a cage with monkeys, right?
Or
Both
a
of them
door.
can, yeah, right? So both of them can kill you, right? But which, you want to stay in monkeys or you want to stay with lions, right? So, it's as simple as that, I think. I don't know. Malaysians are a funny lot, really. You have to put things into perspective where they can see and understand clearer. I think that's the most important things. But I think, Jennifer, probably you can add on to that in terms of pharmacotherapy, pharmacokinetics.
That for generally, actually, what the medication does is actually to work on the sugar level. But generally, as Dr. Shah mentioned, that a lot of people will be worried about the side effect. But it's quite funny, actually, as Dr. Shah said, that people, the first thing they usually ask about medication is what are the side effects?
Side effects, exactly.
They never ask about what is the effect, how does it help you? Ask about the side effects.
Yeah,
And
when you tell them the side effects, they will straight away get them the next time they see you. Right? So don't tell them the side effects. Because if you tell them, they will have it.
there will be the
People works both ways.
They will think of, I will feel that I have this kind of side effects. So sometimes it's better not to tell the side effect up front, but ask them to try it first. Because a lot of patients, I think Dr. Shah has experienced that once you prescribe a medication, they will expect it works immediately, which is actually not the case, because everyone is different. Everyone is unique, and we may react differently on different medications. So there is a period of time you need to do some trial and error. Of course, evidence-based, which one will be most suitable for the patients, and then slowly adjust the dose. But how can the healthcare workers like Dr. Shah, all those adjust the dosage suitable for the patients? Is that we need the communication from the patient itself. As healthcare workers, we only see them occasionally, if they come back. A lot of time, we only see them once and then they are gone with other places. So what we can do is actually communicate on how they feel after taking the medication. And better still, if they can keep a journal on how they feel, any discomfort, anything that is feeling better, any changes on the symptom. And if they are doing their home monitoring on their blood sugar, keeping a record is very important. Because a lot of people, they think that, okay, I need to do blood sugar test. I do my blood sugar test and that's it. It's actually very wasteful of having data in the world of big data now. You have data, but you are not keeping track of it, and then you don't see a trend of that. So it's very difficult to adjust and review how is the condition and to help them better. So it is important for the patient themselves to be part of the plan. In fact, they are the most important person in the plan of management. Without the information from them, we can't do anything. It's based on like every 6 months, once a year, one reading. And based on one reading to make a decision is actually like buying a lottery as well.
I always get my patients to use an app. You can use app. Now there's a lot of apps for diabetic tracking. And some of them, the diligent ones, would actually send it to me every week or so.
Wow.
Yeah, so I get loads of emails like just glucose levels, so which is good. So and there's no reason why you shouldn't be, why patients shouldn't be doing that.
No. Thanks so much for that, both of you. And I think just on the topic of, taking medication or taking pills, I think another very interesting characteristics of Malaysians is that they like to look out for alternative medication or even supplements. And I think on that, Jennifer, do you have anything to add around, what are some of the common supplements that are helpful? And also what are some of the common ones that you have heard in your experience that are unhelpful, but patients are adamant that it's useful for their condition?
I think it's very important for patients to know, even that you are taking supplements, it cannot replace all the medications. A lot of them, they are taking alternative or maybe some supplements that they heard somewhere, it will help them to control the blood sugar. But then you need to know that there is a statistics that's saying that once a person is actually diagnosed with diabetic, 50% of their pancreas function is actually gone. And then it's a progressive disease. So it's very important to keep on your medication. If you want to add on alternative, let us know as well. Else that we won't know that whether what will be the effect will be happening. But generally, I'll usually recommend to take some antioxidants, vitamins. That is actually to prevent the complication instead of to actually control the blood sugar. To control the blood sugar supplement-wise, I don't think there is very strong evidence on that, but the common one, people will be going for the beta-GOT. And there is some, they will be going for chromium. But all this, I'm not very convinced on the data, but I'll suggest that they continue to take the medicine, and then if they want, they add on that. But most importantly, they continue to monitor their blood sugar.
No, thanks a lot for that, Jennifer. So I guess I like that you brought up beta-GOT. I actually personally really like it, although I know it's one of those kind of vegetables that you either love it or hate it. So I think, Michele, on to you, right? I think as fellow Malaysians, we can all agree that our meals or our food forms a very big part of our lives, right? It's even the way that we greet each other, right? Like, have you eaten? Like, was that a good meal? So for a diabetic patient, what are some of the most major behavioral changes, both in terms of their eating habits and also other lifestyle habits that is necessary for them to get right from the get-go?
I think the first step when it comes to diabetes patient is education. They need to know what are the food that can actually increase their blood sugar level. Only equipped with that knowledge, you're able to go out back to society and make the right choices. Yeah. So the first thing as dietitians, what we would do is to let our patients know, or the people know, or the clients know that what are the carbohydrate foods. So basically when it comes to like what Dr. Shah said, diabetes is all about sugar. So sugar comes from carbohydrate food. So they're educating them on what are the food groups that actually have carbohydrate. So just to go on a little bit about that. So there's actually main 5 food groups that we have. So the main carbohydrate group that we have are usually really highly in Malaysian diet, which is the grain groups. So your rice, your bread, your noodles, even things like that, anything that is made of flour. So including
I love
chapati, your mamak food, okay? And then you've got your fruits as well. So your fruits, it's a natural sugar. So people have this misconception that because I'm diabetic, I'm not allowed to have fruits. Fruits is actually an essential food groups in our healthy diet. It's just that with diabetic patient, fruit is also a natural sugar. So they do have to be a little bit careful about how much fruits they take. So the other groups will be your non-starchy vegetables. So your potato, your yam, your corn, legumes also falls into that category. And the last one will be your dairy products and any food that has sugar added in it. So anything with added sugar falls automatically in the carbohydrate group. So making sure that our clients are aware of what are the food groups is very important, so that they're able to balance things out. So knowing, okay, that food doesn't actually have carbohydrate, potentially these are the food that I can have more of to keep me satiated, sorry.
Yeah, no, thanks so much for that, Michele. And I think, some of the things that I've heard from actually diabetic patients, especially those who have just recently been diagnosed, is that they have all this information about what they should and should not eat. But the reality is that we are seldom eating just on our own and planning, or in a position where we can plan for just our own meals. Yeah. So some of the biggest challenges is just, well, how do I educate those around me? And how do I overcome this shy to make everyone eat the same menu as me at home type of barrier that a lot of them are facing?
Yeah, I think this really comes into social support as well. In any kind of chronic disease or prevention of any chronic disease, I think social support really plays a really big role. If your family or people around you are not supportive of the way you are trying to change your diet or make change to your lifestyle, I think that is one of the biggest barriers that commonly faced by a lot of people. I think, again, it comes out the same thing in a lot of situations. We try to educate not only the patient themselves, but also the family members, letting the family members know that actually it's all about balance. It's not just like, oh, I'm taking away food that you like. It's just food that you like may be higher in carbohydrate, will just, have it less frequently. So it's all about educating them that, like, as dietitian, we don't like to think that we're taking away people's favorite food. We are like, taking away the enjoyment that they have in life. It's just putting things into perspective, letting you know what are the food that you can eat more of and what are food that maybe, you want to be cutting down so that you can have a more stable blood sugar level. Yeah. So it's educating not only them, but also their family members and people around them.
Yeah. No, thanks so much for that. So I think now we are kind of moving nicely into the topic of social support, right? Family members and caregivers. Dr. Shah, what are your thoughts around what caregivers need to be mindful of when dealing with someone who has been diagnosed with diabetes?
Actually, being diabetic shouldn't change your lifestyle a lot, right? You should be able to do what you like. A bit of change in your diet, right? Which is, I don't think is an extreme case, right? But try and put it the other way around, in the sense that when the patient is improving, try to use that as an excuse to try and improve the people around you. That's what I usually tell my patients, yeah? So take this opportunity. You are diabetic. Take this opportunity to help other people around you. So the support goes both ways, I think. Yeah. So I think that's very, very important. Also, another thing that's important here when we're talking about diabetes, we've touched about medication, we've touched about diet, yeah. But I think there are a few other things. Stress, I think that's very important. Your stress can move your sugars up and down, and stress is usually a social thing. Yeah, work stress, family stress, yeah. So those kind of things would definitely have an impact to the control of your blood sugars. Exercise, we didn't talk about that, okay? So again, exercise can be a great social interaction with others, yeah? When you exercise, it reduces your blood sugar. Again, is a very social thing for you to do, yeah? So those sort of things I think are extremely important as well. You are right, it's a very social interaction, a very holistic sort of an approach. I think gone are the days where a condition or a disease is just being treated by the doctor. Yeah, so it needs to be a holistic as we have, and it can't be any more holistic than what we have here. But I think we should have a psychologist here as well, and probably a personal trainer as well, right? So yeah, I think it's extremely important.
No, Dr. Shah, thanks so much for bringing up the point on stress, right? And that also reminded me, and I think I read this study, but I need your help to just confirm it, that stress actually makes our blood vessel get smaller, which then impacts our blood flow. Could you maybe share a little bit more about, well, number one, am I correct in citing that study? And also number two, if it is, how does it impact someone with diabetes?
Okay, stress not only, initially you're right, okay, it does constrict your blood vessels, hence causes you to have high blood pressure, okay? But stress is also a major factor in hormonal control, okay? It increases your cortisols, for example, and this can indirectly cause an increase in your insulin production. So it can cause a bit of a change in your glucose. Yeah, so it's not only the constriction or the vasodilation of the vessels, but I think more importantly, you need stress to function. Yeah, you can't go without stress. Yeah, I'm stressed here talking to you guys, three of you, but we need that stress. Yeah. And
good stress.
Yes, exactly. Good stress. Use stress. Yeah. So you really need to control your stress. Everybody's different, And I think you need to find that level where it drives you, but not brings you back in physically, mentally, and so forth.
Thanks so much for that, Dr. Shah. So I think next question I want to address to all of you, right? And I think as we have covered, a diabetes diagnosis not only affects you physically, right? It can also impact you emotionally. But I guess one of the key things is also then the financial implications of it. So maybe you can start with you, Jennifer. Do you have any advice or thoughts around what an individual should do to just prepare themselves financially once they receive a diagnosis of diabetes?
I think if you want to reduce the financial impact, you really need to take care of yourself and control the diabetic or your sugar level. Because that the impact will be if you have a lot of complications. When you have complications, you need a lot of treatment. And at the same time, you may not be able to work when you have your, maybe let's say your eyes got problem, you can't see anymore, you have amputation. That will be a really big impact. So to prevent all this, the first thing you need to do is actually take good care of yourself. Without that, the complications, I think the impact will be really, really great. But being said so, Malaysia has actually quite a good public health system that they can take care of you. But then the number of patients is also a lot. So responsibility of taking care of yourself or taking good care of the diabetic condition, it's actually on the patient itself, no, not other people.
I think we have kind of heard this like a few times now, and I couldn't agree more, right? That it really needs to start from the individual wanting to take control of their lives. And just on kind of the financial aspect of it, I think one of the big myths is also around how healthy eating is expensive. Michele, do you have any thoughts around that?
I mean, if you're looking at cost to cost, I guess with takeaway food, healthier food, it is a little bit more expensive. But if you are looking at being willing to cook yourself, like making homemade things, you can actually buy a lot of like fresh ingredients from supermarket. They're so readily available. So it doesn't have to be expensive unless you're going for that I have to eat in a restaurant kind of situation. Then it can be slightly a bit heavy on the pocket. But if you're willing to make that change in a way that you're okay to go out to the grocery stores and get your own ingredient and make your own healthy recipe, I think it can be pretty cost saving.
Yeah. Thanks a lot for that, Michele. Dr. Shah, do you have anything to add on just kind of preparing someone once they hear the diagnosis and they say, "Allah, doctor, I cannot afford this. This is going to be so expensive." Any advice on that?
Well, I think as everybody has said before, is if you look after yourself well, there's no cost to it, right? Get yourself a pair of shoes, go and exercise, right? That's pair of shoes can last you for a long, long while, right? So I think that you need to prevent the complications. As Jennifer has, if you don't have the complications, then being diabetic, I don't think is as costly as, say, God forbid, if you get cancer, for example. The treatment for diabetes in terms of medication are I'm not saying cheap, but they are kind of affordable. So I think when you're talking about financial burden, it comes with the complications.
Understand. Thanks so much.
As long as you can avoid that,
I think there are options as well. There are like what Jennifer did, there are also public health sectors like Klinik Kesihatan if you're looking for like a cheaper alternative. There are options that you can look into. It's not just a private sector where, yes, it can be a bit more expensive, but there are options.
No, thanks so much for that. And I think now we can also all agree that when it comes to diabetes, like one thing I've definitely learned today, that it's not the diabetes that will hurt your pocket and hurt your body. It's really the complications that comes out of it. So what is so important is, well, awareness to then hopefully prevent it from happening. But I guess we can also agree that awareness or knowledge of all these do's and don'ts and healthy lifestyle behaviors could all be futile if the individual themselves is not psychologically prepared or even ready to embark on the prescribed or recommended treatment path or healthy lifestyle path. So one of the most important thing in that is then to just enable these individuals by surrounding themselves with those who are supportive, right? And I think, Jennifer, you also covered this around how family members, friends, or even being connected to a community of fellow diabetic patients can be useful. So maybe we'll start with you, Jennifer. What are some of your thoughts on maybe how someone can go about looking for a community of those who are either, I don't know, recently diagnosed, maybe are undergoing treatment or have successfully reversed their conditions?
I think that in Malaysia, we have quite a few recognized support group like the Diabetic Association. All those is actually very well support group by the patients, because that sharing of information with the people in the same shoe is actually helps a lot. Because in Malaysia, they will still think that healthcare professional is always like giving instruction on how to take care. They don't healthcare workers doesn't feel what they feel. So it's always like giving instructions. So when you are giving instruction kind of way of information, people will shut down and then they won't listen. So they will. That's why a lot of people will be trusting on their families or their friends or people. They listen to them, but they don't really trust what the healthcare providers say. So I guess one way that what we as a healthcare worker can do is actually, instead of giving instructional and a lot of time we are just telling them, you cannot do this, you cannot do that.
Yeah.
We always give a negative instruction instead of telling them what you can actually do. So in a way, telling people what to do, and you can provide them with a list of association, or even that when they are waiting for doctor appointments, there are a lot of fellow patients or friends that is in the same shoe with them. Just be open-minded, chat with them, then you can get some information from them. Even that if you are in a pharmacy, sometimes I feel that the customer to customer, they chat more frequently and they trust each other better than when they are talking to the pharmacist. So sometimes it's like you need to really stop them and listen to them, and may need to stop them if they are giving the wrong kind of information. So information is everywhere, support is everywhere. It's just up to the individual to open to accept the support.
Yeah, no, that's so well put, Jennifer. Dr. Shah, do you have anything to add on kind of the role of this support group or support network?
Yeah, I think so. I think support networks are available. They're quite readily available. In my hospital, definitely we have a support group for diabetic patients. I have one guy who's diabetic, right? Very, very compliant. He's a very, very good guy. And he's the head of my WhatsApp diabetic patient group.
Wow.
I have a WhatsApp diabetic patient. I have a WhatsApp group for those who have had stents. They proudly tell themselves, I'm in the stent group, okay? So, yeah, I mean, that's, to me, it's extremely good, those kind of support, because they really feel at home, very close. You know, they become friends and they're not strangers anymore. So those support groups, to me, are extremely important, because I'm not saying that they're not good. These big support groups at diabetic associations, NADI, they are there, but you need to make the effort to go there and, you know, get to the meetings. And, you know, where else we have a common WhatsApp group, all my diabetic patients in there. Whenever there's a quarrel, okay, next time we go and see Dr. Shah, we'll see what he says. So that's it, right? So yeah, I think it's extremely important to have support groups, not only diabetes, I think in every disease that we have.
Yeah. No, thank you, the three of you, so very, very much. So I think we've come to the end of our session today. So I think for all our viewers, I hope today's session was as insightful to you guys as it was for me, and it helped shed some light around this highly manageable and in many cases reversible condition of diabetes. And I think this is a very important also reminder for patients who may have been just received their diagnosis to, number one, seek out advice from your team of healthcare professionals. But remember that they are here to guide you, to provide you with recommendation, but action needs to start from you. So you need to take control of your own health. And this requires very careful consideration from all the different aspects, right? We talked about medication. We also talked about supplements that may support that, nutrition, your daily habits, and also routines. Remember what Dr. Shah said, just buy a pair of shoes and it can last you for a really, really long time. And I think secondly, also do not undermine the importance of seeking out psychological support from family members, friends, or even support groups, because ultimately, I think our bodies will only allow us to push as far as our minds allow it. So even if we know all these do's and don'ts, if we are mentally not prepared for it, we simply won't have the motivation or even the internal willpower to behave in ways that we know are good for us. So I think Dr. Shah, Jennifer, and Michelle, thank you guys so very much for being with me here today and sharing your immense knowledge on this topic. We hope to welcome you guys back again for another discussion soon. Thank you so much, guys.
Bye.
Bye-bye.